Good to go here. Well, Katya, thank you. I'm Bill Nordmark. I'm President and CEO of Aver. Our startup healthcare moonshot is to revolutionize the industry through comprehensive and flexible solutions to drive value-based care. So let's talk about the challenges in the market currently today around value-based care. So there's really four main challenges that sit between the industry achieving value-based care needs and where we are today in a fee-for-service world. Number one, the payer-provider landscape is really difficult to contract. So understanding what's in and what's out of value-based programs and how you're going to structure those and the analytics to accomplish those is extremely challenging. The other is the technology infrastructure that is out there is completely built on fee-for-service rails. So the value point a number of years ago of real-time adjudication does not drive towards the value of a value-based care model. Third is the reporting structures that exist today. Pinaki mentioned sharing of data. The reporting structures today don't share data fast enough for folks to actually conduct care in a value or a value optimized way. So the example there is how many times you've seen a provider be in some sort of upside downside risk value-based contract, and the actual quality metrics or quality information that they receive from the payer or a third-party entity comes about 6 months after the procedure, and they're 6 months into their program and they're upside down and cannot direct care from those points. And then finally, as the industry adopts more of these programs, the administrative costs and administrative lifts to achieve the promise of value-based care while medical spend goes down actually leaves organizations with a negative MLR ratio. So there's a disincentive or challenge to achieve high value-based care adoption. So in comes Aver. We are the largest platform in the market to provide end-to-end solutions across payers, providers, and what we call condition-specific businesses across 4 sectors. So we are the only platform that allows these organizations to design any value-based program on our tool set. We have an analytics engine that takes historical data. So for our payer customers, they can design a tool set. They can run 2 years of claims history. They can actually see live, had they been doing this program over the past 2 years, what the outcome of that program would have been in real time. Once they understand the outcome of the program, they can then forward model how they want these value-based programs to function by modeling which providers should be participating, which providers are best cost and quality, what target metrics should be run. And this is in a full prospective, retrospective cap model scenario. We then have a solution to help payer and providers negotiate and implement these contracts. We build networks and we drive those networks down to individual care teams that allow achievement of these value-based contracts. And we have the only engine that actually processes and administers value payments prospectively, retrospectively, end to end. So that solution as a whole, which is extremely flexible, it delivers on the promise to enable all of the different types of value-based programs that are in the market. So if you think about the optimal future of where healthcare needs to go, there will still be some fee-for-service, but there will be a mix of value-based programs of bundles, capitation, total cost of care, and global budget. We have proven success. We have over 300 and, oops, what was that? Sorry about that. We have over 36 million covered lives represented in our customer base. And we have proven impact of reducing medical cost of over 20% while giving a payback ratio to our customers of 7.1%. We have a great team. Our team has come out of early stage equity-backed companies such as RX30, also Cerner, Centene, WellCare, and other organizations. We're here to tell our story. We're here to advocate and thought leadership for value-based care, moving the needle of the industry towards that, which must happen quickly. And we love to talk to folks about their experiences and how we can help the industry, empower the industry along that journey. And I'm happy to take some questions.
Thanks, Bill. Awesome. Can't think of a better sales tool than showing someone how they could have saved millions of dollars by using your by using your solution. On that note, can you tell us a little bit about some specific results that some of your customers have achieved? I'm sure that's fun to talk about.
Absolutely. So I'll give you a very interesting result. So last year, we all know the challenges of the pandemic and the reduction in elective procedures. One of our payers that we worked with conducted 523 knee replacements in a prospective episode. And the prospective episode we administered for them in the year of 2020 on 523 knee replacements saved $7 million in medical spend. That was an enormous savings just on 523 procedures alone. We see that organization over the next 2 years saving near $50 million a year on about 30% growth year over year of those procedures. So the medical spend side of this savings is one, but these are 100% prospective bundles. So they have 100% price transparency, and the consumer knows exactly at the time that they make their procedure appointment or schedule their surgery, exactly what they owe at the time of the procedure. So we have had huge medical spend savings. We've had huge quality savings. And then the consumer experience has been really off the charts. And that was in a pandemic year, right? So we are already seeing in 2021 exponential growth over that.
Those are extraordinary numbers. That's just amazing. So why isn't there more adoption of value-based care methodologies like prospective payments? It seems like a no-brainer. Not everybody is as steeped in this space as you are. So can you walk us through where we're at with that?
Yeah, so there's really three main challenges. Number one, the entities are historically driven towards a fee-for-service world, right? So the infrastructure that we have is all driven towards fee-for-service. And so think about payer claim systems. They're optimized for real-time adjudication and fee-for-service. Even at the provider point of the equation, as Justin mentioned, it's a pay and chase or collect and chase type environment. So number one, you have to build network contracts that are going to change how care is delivered from the inside. Telehealth is a great example. Telehealth obviously has had a huge increase with COVID, but at the end of the day, telehealth, because of the CARES Act, is being reimbursed at the same rates as an office visit. And on top of it being reimbursed at the same rates as an office visit, it's still a fee-for-service claim that goes into the payer. So what we see our value point is redefining the network, redefining the technology to actually process value-based payments so that it is not, a fee-for-service transaction. And then third, engaging the consumer. The growth in high deductible health plans has been enormous. But if you can't tell the individual consumer what they owe at the point of service when they interact and buy that service, then you have a real challenge. So what we've been able to do is really transform the industry from the inside out and bring technology tools, contracting tools, and programs to meet those needs.
Awesome. Well, we have a long way to go, but teams like yours are definitely going to help get us there. Just one quick last question. What procedures are you targeting with value-based care? Is there a limit? Or
No, we've
exercise equipment?
done, we're doing all the BPCI procedures. There's 47 BPCI procedures, 97 Prometheus episode procedures. The biggest lift right now has been in the procedural program. So ortho, cardiac, oncology, maternity is a huge one when expecting a big baby boom from COVID. We're seeing a lot of growth in potential behavioral health. And then we're also looking at some of the programs like diabetes and those where chronic illnesses can be transformed, and the care to chronic illnesses can be transformed away from just a fee for service, let me pay for volume, but really truly pay for an outcome.